Today's ruling could have far-reaching implications, though, on the training and actions of workers in prison. Time to turn to Jason Godin, National Vice President of the Union of Canadian Correctional Officers. So, do you think the jury got it right today?
Well, we believe certainly the jury heard us loud and clear. We were actually the first group in this whole situation to call for a public inquiry, and many of the recommendations that the jury delivered today were very much in line with what we were saying as far back as 2005. So we believe the jury heard us loud and clear. So certainly the recommendations are a key focus for us in the future.
So the finding of homicide, to characterize Ashley Smith's death as a homicide, do you agree with that? Do you accept that finding?
Well, it's the jury's finding, and we have to accept that, and we have to work with the recommendations. I think what's important is the council that did recommend the deliberation of homicide were also very clear to complement the professionalism and certainly the integrity of the correctional officers. And, you know, as you know, this verdict doesn't render anybody guilty, and at the same time, those individuals calling for that verdict were very clear about certainly the officers that were involved, how professional they were, and certainly they've been vindicated throughout this entire process by the jury and by the people that attended this inquest.
I don't know if you talked to the guards who were on watch that night when Ashley Smith died, but do you get the impression that everyone believes that had intervention happened, that she may not have died?
Well, absolutely, and we've said that from the very beginning. In fact, one of the recommendations that the jury did come back was simply the fact that we could intervene immediately without fear of reprisal from our employer, and that's a very, very key recommendation because at the time of Ms. Smith's death, we were certainly wanting to go in there and respond. We were certainly under a tremendous amount of duress and under orders at the time. So that's a very key recommendation, and certainly we've always said since day one is that Ms. Smith's death could have been preventable.
So, you know, a lot of the recommendations have to deal with really changing the basic approach in correctional facilities, particularly when it comes to inmates dealing with mental health issues, that the focus should be less on security and more on treatment. How well equipped are guards right now to deal with inmates who are dealing with mental health issues?
Well, there has to be a balance, you know, between the mental health issues that we have to deal with and obviously the security piece. The unfortunate part with many of the recommendations, and we're certainly not criticizing the recommendations, is there has to be some will by the government to move forward with those implementations and those recommendations. Correctional officers in the last 10 years did, at the very least, receive 2 days of mental health training. However, what's more important is some of our recommendations centered around having 24-hour healthcare staff, which could assist us in the daily duties and work that we do, and certainly in responding to those cases. So there's some very important recommendations in there that we're very much paying attention to. Certainly correctional officers, we are a little bit better equipped than before, but at the same time we're also insisting that we have a special facility that we can balance, you know, the security portion along with the clinical portion, that it would allow us to deal with high-risk women offenders. In fact, we tabled proposals back in 2005. So that's a very important element that's missing for us, but at the end of the day, it's really the will of the government, and with, you know, $297 million cut out of the departmental budget, it's going to be hard to enact some of those recommendations.
Because I would assume just even looking at the recommendations that talk about better resources, better training, and a fundamental shift in approach, we're talking about a pretty high cost overhaul.
Yeah, we're talking about a lot of money, and at the end of the day, you know, I think everybody wants to do the right thing, and certainly as correctional officers, we have, you know, very publicly wanted to have all of this come out. At the same time, we're hopeful, and we'll continue to push on those recommendations. But again, it's going to be the will of the government, and unfortunately, the department, certainly in fairness, the department and the Commissioner of Corrections, he just doesn't have quite the budget to implement many of those recommendations. So this is something that all of the various groups that were involved in this inquest will have to push on with the federal government.
And what do you hear from your rank and file? If you look at these recommendations, what would be an important first step in changing things for the better and being more responsive and better able to deal with the many complex issues that come from mental illness?
Well, I think the first thing, one of the first important things is obviously having the 24-hour healthcare staff on, right? Of course, when we're responding to emergencies. More importantly, which is more of a long-term requirement, would be around the whole issue of a specialized, intensively supportive unit that would be able to manage these high-risk women offenders. So this would be more of a long-term vision that would be quite costly. So those are key things for us right now. And of course, the other recommendation around, we certainly aren't going to be, held under duress for making a decision to respond immediately, and that we don't have to fear reprisal. So those are things that are very, very important to our group of frontline workers, but it's going to take a concerted effort and a lot of work to get many of those recommendations implemented. We're certainly not criticizing the jury's recommendations, but we also have to be realistic in this day and age, and we're going to push in the areas that we need to push in to make sure that some of those recommendations are indeed implemented.
Jason Godin, thanks for joining us today.
Thank you very much.